Hi, I'm Tracer Foster, a home healthcare agency business consultant. Welcome back to the Home Healthcare Administrator Training Program, module number 3. In this section, we're tackling one of the most important aspects of running a successful home health agency, financial management. Effective financial management is what keeps your agency running smoothly, ensuring that you have the resources to provide quality care, pay your staff, and remain compliant with regulations. In this session, we'll cover budgeting and financial planning, revenue cycle management and billing, payroll and expense management, and cost control strategies. Let's get started by looking at the foundation of financial success, budgeting and financial planning. First, a well-structured budget is essential for financial stability and long-term success. A home health agency's budget should account for both fixed and variable costs while ensuring profitability. Budgets should be completed at least 3 months before the beginning of your first or your next fiscal year. Your agency's budget should include, at a minimum, revenue projections, number 1. That's estimated income from Medicare, Medicaid, private insurance, or any private pay income you may have. Number 2, operational costs. These are expenses related to office operations, such as rent, utilities, and administrative salaries. Number 3, your direct care costs. This includes your wages for your caregivers and nurses and therapists out in the field, along with your medical supplies. Number 4, compliance and licensing fees. This could include state and federal licensing, insurance costs, and accreditation fees. Number 5, marketing and outreach, such as advertising, referral partnerships, and community engagement expenses. And finally, create an emergency fund. This is a reserve for unexpected expenses, salaries, or any cash flow gaps that may arise. Next, to create a financial plan for your agency, follow these steps. Number 1, assess your past financial performance. Analyze your previous year's revenues and expenses. If you are a new or a startup agency, you will need to estimate revenues and expenses for each month for the next 12 months into the future. Number 2, set realistic financial goals. Establish achievable revenue targets and cost-saving benchmarks. Number 3, track your key financial metrics. Monitor cash flow, profit margins, and billing cycles, or anything else that your software can measure. Also consider whether you will pay your staff weekly or every 2 weeks. And number 4, adjust as needed. Your financial plan should be flexible enough to adapt to changing industry trends and reimbursement policies from insurance payers. With a solid budget in place, let's move on to how you actually collect revenue through billing and revenue cycle management. Revenue cycle management, or RCM, is how your agency gets paid. Understanding the billing process for Medicare, Medicaid, and private insurance companies is essential for financial stability. The revenue cycle involves several key steps, such as, number 1, patient intake and eligibility verification. Once you are in contract with your insurance payers, confirm that the insurance coverage for the patient and the pre-authorization requirements for them have been met. Ensure that you have the appropriate physician orders or insurance authorizations to begin care if you are receiving payment from a government entity or a commercial insurance company. Number 2, service documentation. Ensure that all visits and services are properly documented for billing compliance. Your field staff notes must match your client care plans exactly. Number 3, claim submission. Submit accurate claims to Medicare, Medicaid, or private insurers. Number 4, payment processing. Track reimbursements and follow up on unpaid or rejected claims or invoices as soon as possible. And accounts receivable management. Reduce claim denials and minimize outstanding balances. Reviewing your aging report on a regular basis, at least weekly, and contacting the appropriate parties for resolution will keep your income coming in. Now, billing for different payers is something else to consider. Medicare billing, for example. Home health agencies billing Medicare must follow the prospective payment system, or PPS, which determines reimbursement based on patient assessment and care needs. Ensure that all OASIS, that's the outcome and assessment information set, documentation is accurate in order to receive full payment. Medicaid billing. Medicaid reimbursement varies by state, so it's important to stay updated on your state's requirements. Timely and accurate documentation using EVV, or electronic visit verification, is key to avoiding claim denials. Next, private insurance billing. Many private insurers follow Medicare guidelines, but may have different authorization and reimbursement processes. Build strong relationships with these insurance providers to streamline your billing efforts with them. And finally, private pay billing. Send out regular, frequent billing invoices that clearly indicate the services that your agency provided, the date of service, the name of the caregiver, and an online or automatic payment portal option via credit card for the fastest payment methods. Review your accounts receivables aging report regularly for any private pay money owed to your agencies. Mistakes in billing can lead to revenue loss. That's why having a strong payroll and expense management system is crucial. Now, one of your biggest financial responsibilities as an administrator is managing payroll and expenses. With caregivers, nurses, and office staff all needing compensation, payroll must be handled efficiently and accurately. 1. Key payroll considerations. Payroll processing. Use automated payroll systems to calculate wages, overtime, travel time, and deductions or withholdings correctly. Be sure you are aware of any county, city, and state minimum wage requirements where you operate. Next, compliance with labor laws. Ensure that your agency follows state and federal wage and hour laws, including overtime rules and employee classifications. HR posters should be prominently posted in employee areas in your office. Next, managing employee benefits. Health insurance, paid time off, and retirement plans should be factored into your payroll budget if required. Next, mileage and travel reimbursements. Many home health employees travel between patients, and reimbursing mileage and travel time correctly is essential for employee satisfaction and U.S. labor law compliance. Aside from payroll, managing other expenses as well is key to maintaining your profitability. That includes tracking and controlling expenses. To keep your costs under control, consider these best practices. Number 1, categorize your expenses. Separate your direct care costs from your administrative expenses in your chart of accounts to see where exactly your money is going. Next, use financial software. Automate your tracking and reporting to avoid errors. There are many software systems available to you out there to choose from. Next, set spending limits. Ensure that all your employees adhere to approved budgets for supplies and operational costs. Speaking of cost control, let's explore how to improve financial efficiency. Reducing unnecessary expenses without compromising patient care is a challenge, but it is achievable with the right strategies. First, efficient staffing and scheduling. One of the biggest expenses in home health care is labor. Efficiently scheduling staff based on patient needs and personalities can reduce overtime costs and improve productivity. Select a scheduling software platform that works best for you and for your field staff. 2, supply and equipment cost reduction. Buy medical supplies in bulk, negotiate contracts with vendors, and monitor inventory to avoid waste. Ensure that you use any medical supplies before they expire to save money on replacement costs. Number 3, technology implementation. Using electronic health records, or EHR, and automated billing systems can reduce administrative costs and improve efficiency. Number 4, preventing employee turnover when possible. Hire and training new staff is incredibly expensive. Invest in employee retention strategies such as competitive pay, career development, and a positive work environment to reduce turnover costs. Don't forget to implement an employee recognition program as well. When these practices are implemented correctly, these cost-saving strategies can significantly improve your agency's financial health. Now that concludes our session on financial management for home health agencies. We have covered budgeting, revenue cycle management, payroll, and cost control strategies. All are essential components for running a financially successful agency. Financial stability isn't just about making money. It's about ensuring that you have the resources to provide top quality care while remaining compliant and competitive in the industry. In our next section, Module 4, we will dive into standard operating procedures, emergency preparedness plans, and infection control. Thanks for your time today, and I'll see you in the next video.